Welcome, everyone, to another edition of SCRC's Let's Talk Caregiving. I'm your host, Roberto Velasquez, President and CEO of Southern Caregiver Resource Center. And I'm here, as always, with my co host, Marta Rañón, our Executive Vice President. Hi, Marta.
Hi, Roberto.
Today's special guest is Dr. Zvinka Zlatar. Dr. Zlatar joined UCSD in 2016, where she currently is the principal investigator of WISE Lab, which is the Wellness Initiative for Senior Enrichment Lab. This is wonderful. I mean, I don't know much about the WISE Lab other than I know that you are working on behavioral factors and lifestyle interventions like exercise and diet that affect brain plasticity and cognition in aging. What a wonderful what a wonderful research that you are doing there, because there's so much going on in the community about brain health and healthy brain initiatives and things of that nature. So I'm really happy you're joining us here today.
I am happy to be here.
Dr. Zlatar, I am so glad that you're joining us today because I know we've talked a little bit about the research that you are doing, but I am not sure that our audience is that familiar. So, if you can give us a quick synopsis of the work that you are doing, just kind of to lay the groundwork of the wonderful research that you're involved with.
Yes, so in my lab, like Roberto was describing, it's called the WISE Lab. It's just a research lab at UC San Diego. And we focus on studying how different lifestyle interventions, or, when people change a habit such as their exercise, how that affects the brain over time, the structure of the brain, blood flow in the brain, as well as their cognitive function, like their memory and other cognitive abilities. We also study a lot about early risk markers for Alzheimer's disease, especially within the Latino community here in San Diego.
That sounds so
Well,
wonderful. And I know that there is a lot out there about changing your lifestyle, changing your diet, doing exercise. And so I was just curious, what is it specifically that you are looking for? Because, there's so much out there. And I think people sometimes get overwhelmed. What is this? How is this different?
What's different about our research program is that we really try to focus on bringing the interventions, or, for example, the exercise interventions, to people in their homes and in their own what we call free living environments. Because usually, when we do this kind of research, it's really hard for people to, for example, come to a specific location to do exercise, 2 or 3 times a week, or it doesn't really fit into their lifestyle that easily. So one of the things we do is that we try to use technologies to help us help older adults in their own environments, so that these technologies can be assistive to them, to help them increase their level of physical activity, for example. So that's one of the things that of the projects that we do a little differently.
Dr. Slatar, what type of technologies do you introduce families to with these types of studies that are going on? Is it like, are they
There
apps? Is it telehealth? I mean, what is it that you're doing to bring technology to help families?
Yes, in different projects, we've used different technologies, very simple technologies. For example, the Fitbit, which a lot of people have and are familiar with, or other kinds of heart rate trackers that just measure, your heart rate and for how long you stay in a certain heart rate range that could be beneficial for brain health, for example. So those are the technologies that we use most. Very simple, and they're out there, and a lot of people already have them. These things link with your smartphone, for example, so that you can have access to the app. But we also gain access to those data so that we can see how people are changing over time using these more objective measures, rather than people reporting to us, oh yeah, I exercised for 30 minutes today, for example. Sometimes we're not really good at estimating for how long we've been active, or especially in what kind of range of exercise we are. We don't, it's really hard for us to do that on our own without these technologies.
I'm smiling because I would like to say that I run for an hour when I'm in fact only walking for 5 minutes. So yes, estimating my exercise output is can vary. Dr. Slaughter, you know that we are always focusing 100% on the family caregiver, and I know your research is focused on how these interventions really impact the trajectory of the disease development, specifically with Alzheimer's and dementia. Are these activities ones that are focused on the caregiver or on the care receiver?
So these are for these interventions, it could be, I would say, mostly geared toward the caregiver because we are not really working with individuals who already have Alzheimer's disease or severe memory impairment, for example. So we are enrolling in our studies people who are still what we call cognitively healthy, that they are independent in their activities of daily living because there are a lot of instructions to follow, like the technology to be used. And so usually someone with dementia would have a lot more difficulty following those.
So, Dr. Slatar, have you had any outcomes yet from your studies? How long have you been doing some of these studies there at UC San Diego?
Yes, we've had some outcomes. The first study that I did a few years ago, it was a small pilot study, and we used these heart rate tracker devices to help older adults be able to walk faster when they go out for a walk. For example, we would prescribe them a specific heart rate range so that they would spend more time in what we call moderate intensity physical activity, which is what we think can have more benefits to the brain. So we were trying to help people keep their heart rate at a certain range with this technology. And what we saw is that in that specific project, where people for 12 weeks wore the device and followed an exercise prescription that we gave them at home at their own pace, whenever they wanted to exercise, and we tracked them with these devices, we saw that people increased the time that they spent in this moderate level of activity by about 67% over 12 weeks. So they really increased the amount of time that they spent. And this range is what is recommended for healthy cardiovascular health. It's 150 minutes a week of moderate intensity exercise is what the CDC and the World Health Organization recommend for adults just to maintain cardiovascular health. And so we were really proud of being able to see that these devices can help people and that we did see some changes also in the brain. So that was kind of like the catalyst to other projects that we have going on right now in which we are collecting data.
And so I'm curious because I know that you are very focused on the Latino caregiver, the Latino community. Why is that? Why is there such a focus? Is that something that you're seeing that perhaps needs intervention?
Yeah, so I think there's several reasons. I am Latina myself, and so as a scientist, I wanted to make sure that I represent my community and that they are represented also in clinical research. And so, as we go through our academic careers and we, fund the projects and run these projects, it becomes evident that there is a lack of representation of the Latino community in research studies. And so, I've been really trying to change that, at least in my lab, so that we can have a large representation of the Latino community, especially because Latinos that live in the United States uh, seem to have a higher risk of being diagnosed with dementia and other related, dementia disorders.
I'm so glad you said that, representing the community. Myself, Marta, of course, we're from the Latino community as well. And one of the things that I did over 16 years ago now with Southern Caregiver Resource Center is started to introduce evidence-based programs that we culturally adapted to be delivered in the Latino community. And although we were not doing research projects because we're a social service type of organization, we don't do control groups and things of that nature, or you let everybody participate. We did measure pre and post people going into the intervention and then leaving the intervention, not compared to control group, of course, but we did see statistically significant changes in people who participate in programs like our Calma program, um, and where they went in with high levels of depression and high scores of burden, caregiver burden, and poor health scores to becoming really reduced levels of depression and burden and improved self-reported health as well. So it's just wonderful to see these types of outcomes. So I'm excited that you're doing that and really focusing. And I think one of the biggest things that we've all seen over time is that there is a lack of or limited involvement of Latino families in these types of programs, for a number of different reasons. Language barriers and cultural barriers, religious barriers, all kinds of different things. So it's great to have these efforts really culturally adapted and really targeting communities, minority communities that can help relieve them of some of the problems that they might be encountering over time, especially with chronic conditions that are developed often, like diabetes is very high, for example, in the Latino community, which leads to heart disease. So I appreciate all the efforts that you're doing.
So then, how does an individual, especially from the target communities, get involved with your research? Is there a number that they can call, or how would be the best way for individuals to connect?
Yes, we have a phone number, which is 858-822-7737, where they can leave a voicemail. They can, in Spanish or in English, they can leave us their name and their number, and we can call them back and see if they may qualify for one of the studies that we have going on right now. We also have an email, which is called mentesana at, at health.ucsd.edu.
And I
It's
think that it's also very important for especially, Latinos who might be interested in participating, that the benefits of just having new methods of including this self-care, right? Developing new lifestyle changes is always a benefit, even if you are not necessarily participating in a study, but just to look at the challenges that caregiving brings. So to be able to adjust and maybe incorporate some self care, this is always what we are talking to our caregivers about. We're always including self care. What can you do to take a break and reduce some of the stressors that caregiving brings? Because it is challenging, it is difficult, especially if you're caring for someone with Alzheimer's or dementia. So I just wanted, to share that with our caregivers out there, that if you're, I don't know, maybe I don't know about participating, if anything, you're going to gain insight into incorporating some of these positive lifestyle changes into your busy lives.
Yes, and the good thing with this Mentesana study is also that it's fully remote. So, I know that caregivers, most of the time, time is a big limitation, right? So they have a lot of responsibilities, and so they don't have time to travel to a location or go to appointments. But we do everything via telephone for this study, including measurement visits, intervention visits. So we just use basically the internet. If you have a smartphone with internet connectivity and you feel relatively comfortable using that, you can potentially participate if they meet the criteria for the study.
That's wonderful to hear. I know that we at Southern Caregiver Resource Center have done quite a bit of changes in our business model, where we provide so much of our information through live streams, through the internet, through podcasts. Like, for example, this podcast that we're recording, we've been now doing podcasts since 2017. So we also acknowledge the fact that family caregivers have very, very limited time. And we want to make sure that the resources that we provide, that our partners provide, can be accessible to them at different times. And like you said, the exercise, they could do it at any time, you know. Um, you know, if they're involved in the study, they can after dinner do a they could even walk within their home, you know, if they have a staircase, go up and down the stairs a little bit. It doesn't have to be too extreme. But I do know that, as Martha was saying, we also incorporate exercise, meditation, music, different types of activities into healthy caregiving. And it sounds like it all lines up with some of the studies that you're doing there over at UC San Diego.
Yes, we have a big focus in my lab specifically on exercise and education about brain health. So, you know, we also have in the study, Mentesana study, people get randomized to one of two conditions. One of them is an online program where they learn about different topics related to how to improve their brain health. And then the other one is working with a coach to try to spend less time sitting, more time moving around. And both are equally important because the online program helps people set individualized goals around other aspects of brain health as well. So they'll learn about nutrition, cardiovascular health, and how it's related to the brain and dementia risk. So so it has an educational component as well, depending on what group participants are assigned to.
I love that. And maybe because I'm partial to the educational outreach that we do in the community, but the idea of brain health, I think for a long, long time, there was this inability to connect the brain to the rest of the body. We just go to the doctor for our physical ailments that don't seem to include the brain. And now, of course, we're learning that the head is connected to the rest of the body, and therefore we need to take care of it. And I think that that is really important because it's still something that we need to talk about. You know, mental health, reducing stress, those are all, they can lead to physical ailments, right? Yeah, it can have a negative adverse effect on your body. And that's why we're so glad that we are learning about the work that you're doing, because at SCRC, we do see a lot of our caregivers who come to us extremely overwhelmed and extremely stressed. And it's really just a matter of kind of refocusing. Okay, what can we do to alleviate some of the stressors? Are the person that they're caring for is still going to be there, right? There is still no cure for something like Alzheimer's. And so, how do we approach those challenges? And many times it is that change of perception and really focusing on that brain health mentality.
Yes, and it is really difficult to change our habits. So that's why
Mm.
we really try to work with our participants to help them one on one and to help them fit these habits into their daily life so that it's sustainable.
Dr. Slatar, just one real quick question, because it is difficult to change behaviors and habits. What would you say in is the average time that it might take of doing something consistently to maybe it becomes part of your lifestyle now, it becomes part of your change or your new routine? Is there a time frame? Is there like 60 days, 90 days, 120 days? I mean, how long does it take somebody to actually change or incorporate something to make change in their behavior?
I don't know that there's a specific timeline, but what I would say is that consistency is key. So the more consistent people are about fitting something into their daily lives, the easier it will be for them to maintain that over longer periods of time. So usually, if we come up with like a New Year resolution that, hey, I'm going to go to the gym every day, from 6 to 7 a.m. and do this and that, that's not really likely to continue or stick, right? Because it's not something that is incorporated into our daily life. So we really try to go around, what people already have, what they have around them, that, if they have a park around there, or if they can just go around their house a couple of times for 10 minutes when they have 10 minutes, that is a good thing to start. And that is something that people can easily do over time, and those small changes do make a difference over time. So I would say being consistent and fitting it into your daily habits as much as possible.
Absolutely. And really doing something that you might already be doing, right? So if you're drinking a cup of coffee in the morning, fully enjoy that time to yourself to drink that cup of coffee and enjoy it without doing anything else. No cleaning, no taking out trash, no doing anything else except just drinking that cup of coffee. At least that's how I've incorporated my stress relief in the morning.
Yeah, I know, Martha, you always talk about being in the moment, being present when you're trying to do something to help, either whether it's self meditation or just focusing on something that gives you pleasure, so that it really kind of you absorb it and it's not just something that you do and then you're running off to do something else. So taking that time really, I think, helps. And I think with exercise, even if it's 10 minutes, 15 minutes, um, that you're really focused on that 10 minutes of that exercise, whatever you're doing as part of your daily routine, I think is really important. Well, that's all the time we have left for this edition of Let's Talk Caregiving. To hear more of our podcasts, follow us on your favorite podcasting platforms or visit our website at scrc.care. I want to thank Martha for co-hosting another important discussion and Dr. Zlatar for joining us today and our audience for tuning in. If you're providing support to a loved one, you don't have to do this alone. Asking for help is not a sign of weakness, it's a sign of strength. To connect to our programs and services, visit our website at scrc.care or call us at 1-800-827-1008. If you live outside of San Diego and Imperial counties, visit caregivercalifornia.org and connect to the closest caregiver resource center near you. To support our efforts and make a tax-deductible donation, go to scrc.care and click on the Donate tab. And remember, SCRC is here for you,
Caring
caring
for
for
those
those
who
who care
care for
for others.
others.